The one that says drtaz.com update. That was sent out Friday.
Okay.
Ready?
What I do?
Nothing. You're on Instagram, right? Is
Yes.
yours Instagram?
Yes. This is mine. This is Lily's.
Okay. I know we're live on YouTube already. Let's go ahead and go live on some of these other channels as well. All right, we're gonna wait for some of you to come in. We're running a little bit behind today. We are sorry for that. Been a busy morning over here, but I hope everybody is doing well. This is Tuesday Lives with me, Dr. Taz. And so as folks are coming in, I don't know if you care about this, but I'm going to share anyways. I'm super excited. I was officially told to stop wearing the boot because it's actually messing up my gait. It's messing up how I walk because I'm like, I've got one hip off to one side and one not using and all kinds of mess. So I'm actually trying to walk normally, and it's very exciting. So I still feel weird, and I'm wearing the ugliest sneakers you've probably ever seen in your life, but hey, progress, right? Making some forward movement here, so super excited about that. For those of you who don't know, I had an Achilles injury back in December, and it's been quite the journey. Surgery in January, and quite the journey to get moving and actually get going here. So let's talk about a couple of things. Okay, I gotta ask my team, they're sitting back here. Is TikTok really banned? What's going on?
Government phones is definitely banned.
Government phones, TikTok is banned. Now we've got folks right now on YouTube, Instagram, and on TikTok. So how do you guys feel about the TikTok ban? Definitely on government phones. I know a lot of us are on all the platforms, right? But curious to see what you think. Let me know, maybe post a comment or two and let me know what you're thinking there. And then as I start to talk here and ramble on, definitely send us your questions because this is really more about you than it is about me. And I definitely want to hear what questions you have and make sure we have an opportunity to answer those. So I'll get started in just a second. You can just type your questions into the chat and we will take them as they come in. Now, a couple of things. I will start with what caught my eye. Here's what caught my eye today, and this is, I'm actually going to post about in a minute too, but this is a huge debate in our homes. So I don't know about you guys. How many of you drink tea? That's me. And how many of you guys drink coffee? Well, that's my husband. So my husband came home yesterday and told me that he was so exhausted. He's been working a lot. They're down a dentist. He's a dentist, by the way. That he had 3 cups of coffee, and I think he had a Coke Zero on the way home. Now, what is wrong with that picture? First of all, obviously a ton of caffeine, right? But secondly, he actually has a heart condition. And today, there's a study out talking about coffee drinking and your heart. Specifically, drinking more than 1 cup of coffee a day has been linked to something called PVCs, or premature ventricular contractions, that give you some extra beats essentially in your heart. And when that's happening over a long period of time, that in turn leads to heart failure. And I don't think anybody wants heart failure. So what's the answer? The answer is to really reduce your coffee drinking down to 4 to 6 ounces a day. So 1 cup, right, which is about that 4 to 6 ounces or so. 1 cup actually was found to get people up and moving and kind of doing their thing. It did still interfere with sleep. More than a cup not only interfered with sleep, but then again drove cortisol up, drove insulin levels up, and then impacted these PVCs and PACs, impacting heart failure. All right, so moral of the story is bring the coffee consumption down. Maybe first thing in the morning is okay, but not throughout the day. Maybe it's a treat, but not an everyday thing. And it doesn't mean just because we're talking about coffee that you turn around. Not only my husband, I need to show my daughter this. It doesn't mean that Celsius and the energy drinks and all that other stuff are a great substitute. Okay, so caffeine is caffeine. Caffeine in excess is impacting our health, our hormones, and our heart health, our blood pressure, and so much more. And at the end of the day, impacting your heart. Remember, heart disease is not a male-only problem. How many of you guys think that heart disease is male only? You can get a little bit wave, but we're actually finding more and more women dealing with heart disease, and it looks different in women. First of all, it's not the crushing pain that radiates to the left and you're bent over. You know, that's a very classic presentation for a male. But for a lot of women, it's almost like you're having reflux, or you're having back pain, or sometimes it's even severe abdominal pain. So if you've got the risk factors for heart disease as women, especially as super women, when you're juggling a lot and you're running around and it's annoying to stop for a minute and take care of your health. I know I feel this way sometimes, but remember that heart disease looks different in women than it does in men, and it's really important to keep that in mind. Further, we understand that heart disease risk goes up in women in perimenopause and menopause, and here's the reason why. The reason is simply because as you have the hormone shift, the cholesterol markers go up. So lipids go up, blood pressure goes up, weight's also going up for a lot of women, and all of that together is increasing sort of your cardiometabolic markers, which increases your risk for heart disease. So just a gentle reminder, started with coffee drinking, but really thinking through, what do we need to do to make sure you are, kind of balancing your risk for heart disease, getting screened when it comes to heart health. There are many different screening tools, definitely screening for, cholesterol, total cholesterol, triglycerides, that's helpful, but also knowing your numbers, right? What's your blood pressure number? What's your heart rate at rest? What's your heart rate when you get super active? I think all of these things are really helpful in terms of understanding what's going on with your heart. I think that there's a very easy test that you can have your doctor orders, a coronary calcium scoring test. And with that particular test, you can look if there are any blockages in the heart, and is there something that you need to do there. So maybe think about doing that at least once a year, especially if you have these markers, or maybe every couple of years if you don't have the markers. And then of course, get your hormones checked. We talk about this over and over again, right, on these channels, and the importance of getting those hormone levels checked and understanding the direction your hormones are going in. And I talk a lot about like estrogen and progesterone and thyroid, right? But cortisol and insulin matter too, right? Cortisol is again the stress hormone. And if you're functioning constantly in a really high cortisol state, you're always stressed, you're always rushing, you're always running, you're getting super anxious with the slightest thing, well then that's putting a burden on your heart as well. I actually had a patient yesterday in a very high cortisol state. We were just discussing possibilities of what could be going on with her. She was actually having something due to a lot of stress, right, and a hormone shift post-pregnancy with her second child. She was having a lot of blood sugar dysregulation. And that blood sugar dysregulation, meaning her blood sugar would go from high to low, and she would only feel better if she would eat something, and if she didn't eat anything, then she would just crash out. She described it almost like as this kind of flushing feeling that would overtake her entire body. Well, if she didn't eat, then she would go into a full-blown panic attack. So again, the connection between cortisol and blood sugar and insulin and how these things are so connected, right? Normally somebody would say, here, you're just anxious, here's an anxiety medication. But really what she needs help managing is her blood sugar, her insulin levels, and her pattern of eating to help manage kind of what's happening there, along with keeping cortisol levels in a great place. If you give coffee, going full circle again, if you give coffee to somebody like that, then it's basically putting fuel to the fire. So any of you that are super stressed and having a really intense day, drinking cups and cups of coffee to keep going is simply not the answer. I would encourage you guys to look at your nutrient levels, look at your hormone levels, and understand if energy is getting depleted for an issue like the fact that there is a plan, or what is it? It's all hormones. If your hormones are not getting metabolized effectively. So what's happening is there's this super false sense of security that, turn is really impacting your risk for cancer. So breast cancer risk increases with the decades. So the longer, like for many young women that might be watching, if you're on the birth control pill for birth control for maybe 5 or 6 years, right? Not a big deal. We're not saying you're going to go out there and get cancer. But when that birth control pill becomes 10 years, 15 years, 20 years, that's where we start to see a problem. And that risk is an increase of 20 to 30% of your baseline risk. So if you've got a family member with, breast cancer and you have a slightly higher risk, or if you've got, a weird mammogram, you have dense breast on your mammogram or on an ultrasound or things like that, and you have a higher risk, you add 20% to that risk if you are on the birth control pill in terms of your risk for cancer. All right, so hopefully that helps kind of frame that debate. And yes, it did indeed talk about both progestin and estrogen. I would add in, we need to be thinking about our own hormones too. All right, so that's the debate around the pill. So as with all things hormones, really being careful, right? At the end of the day, being super careful and understanding what your hormones are doing. Do you have the genetics for breaking down hormones? Are you able, to metabolize hormones effectively? What is it that you need to be doing to really help, the hormone conversation? And hormones, and as they change, impact every other aspect of our health, our heart health, our gut health, and so much more. All right, so hopefully that's helpful. All right, we're going to start taking questions. I think a lot of questions are coming up. Love to know where you guys are from too. So we want to always get a sense of where questions are coming in from. So if you feel like it, share where you are from. But we're going to talk about a couple of things. So tonight we have Superwoman Circle coaching. How many of you guys have joined the Superwoman Circle? It is an incredible group of women coming together to really dive into their health and be accountable for one another. But what we are doing tonight, they are all, they've done my weight loss quiz, and we're going to review their results because so many people are worried about weight, trying to lose weight. I see some questions about Wegovy and Ozempic and all that other stuff, which we can get into. But it's important to understand that for many people, weight loss needs to be personalized. And when we bring together the East-West philosophy, it's a lot about personalization and really crafting the right plan for you. So, some of you need to be gluten-free and dairy-free. Some of you need to be vegetarian. Some of you actually need some red meat a couple of times a week. Don't shoot me for saying that. But it's very much crafted to you. So I would say if you haven't done it yet and weight is your concern, take the weight loss quiz and join me in the circle tonight, and we'll go over everyone's testing that is helpful in understanding why you make decisions you make. Like take me, for example, very go-getter, yang dominant in Chinese medicine, 8 on the Enneagram, all of these things, ENTJ on the Myers-Briggs. Well, what's my Achilles heel, so to speak, or my weakness is that I'm not going to stop for a second and really understand what's going on with my health. And so my gut, my thyroid, inflammation markers can get high really quickly. So those are some of the things that we're going to help our people in the Superwoman Circle community unwind and really get a better understanding of. So if you haven't joined, just go to drtaz.com/superwoman. You can join and join our coaching circle tonight. You still have time. I think it's at about 8 o'clock tonight, so it should be a lot of fun. And the other thing we're super excited about is our boxes. How many of you guys have seen the box? So we've got now a beauty box, a Superwoman box for energy, and a hormone box. And it comes with a lot of fun stuff. So for example, the hormone box has my East West Way products in it, but it also has a hormone workbook for you to really sit and understand kind of what's going on with your hormones versus everybody else's. The energy box, we've got recipes for protein smoothies, affirmations to keep you in a positive mindset, right? Saying hi on that emotional scale that we talk about. And then again, products to help keep your energy up and running. And then last but not least is the beauty box, which we're super excited about. That has in it, you can do a quick glance, you can see, but it has in it your gua sha and jade roller, right? To really help improve blood flow to the face, which I think is so important. A couple of East West Way products, and it has my new shampoo and conditioner. Have you guys tried this yet? So this is incredibly moisturizing, has a lot of great herbs in it, olive oil, japonica root, angelica root, again, really merging that East-West sort of idea together. And the smell is of Palo Santo, which is actually a scent that is supposed to help get rid of negative energy and really help be very soothing and anti-inflammatory. So the boxes are up on the site as well if you want to give those a try. Again, just go to drtaz.com. I think the link is in the bio. Just hit the link in the bio and you will be able to get directed to one of those. They make great Mother's Day presents too, FYI. Don't forget, Mother's Day is coming. And so that's a great present that you could send to a mom that might just need energy, hormone balancing, or just wants a more holistic, natural way to boost beauty. Okay, let's take some questions. Let's see what's on everyone's mind. And I've been looking at where you guys are coming in from. We've got folks from Algeria and the Netherlands and New York. And did we see anything else? I think those were the main ones that I saw, or at least that folks for sharing. But let's take a few questions and we'll go from there.
So one on TikTok, Luann asked, can insulin resistance be reversed?
Insulin resistance can absolutely be reversed. And it's, again, a lot about getting your diet, your gut health, and your sleep pattern all in the right place. So eating every 4 hours, making sure you're sleeping 6 to 8 hours per night and getting deep, consistent sleep. And then even looking at your gut health. Maybe probiotics might be helpful from time to time with that. Digestive enzymes, adding in some glutamine, all of this is helpful for insulin resistance. The patients that have trouble with that will move on to things like berberine, which is a supplement that I love using, along with maybe going to a medication if we're still not getting results, and that's when we get into the whole conversation around metformin, Wegovy, Ozempic, all that stuff.
And Laura would like to know, how often do you see high blood pressure in women going through perimenopause and menopause? What can women do to lower blood pressure?
It's such a great question. So this question is about blood pressure for women in perimenopause and menopause. I see many women experience that. In fact, shocked that they never had an issue with blood pressure and suddenly their numbers are high. Again, a lot of that is due to the hormone shift. Increasing cortisol, increasing insulin, increasing belly fat, that triangle kind of goes together. Now, what can you do? There are a number of different things you can do. For example, you can take some magnesium nightly, and that magnesium does help to lower blood pressure. So you can do about 200 to 400 milligrams a night. You can also add about 4 ounces of celery juice. I'm not going to lie, we did this with my dad and dropped his blood pressure about 10 points to the point that he was on like 4 medications. I was actually able to get him off a few of them. So adding about 4 to 6 ounces of celery juice per day is helpful. And then there's an Ayurvedic herb that I love and we actually use in the practice at Center Spring MD called Mukta Vadi, and that one is very helpful as well in terms of lowering blood pressure. So you can do all of that, but remember, getting movement, sleeping consistently. You can add an acupuncture as well. These are all things that are super helpful when you're thinking about an east-west approach to blood pressure management.
Okay, going back to Wegovy, someone asked, I'm getting the new weight loss shot today. Is Wegovy dangerous?
Wegovy. All right, everyone know what Wegovy is? So it's another one of the semaglutide medications that are blocking and lowering blood sugar and insulin and helping a little bit indirectly with hunger as well. Is Wegovy dangerous? I don't think it's dangerous. It does have side effects. So don't think that it won't. Many of these shots, whether it's Mounjaro, Wegovy, or Ozempic, you do have some nausea in the initial weeks, and then over time it does seem to go away. You usually start at a low dose and work your way up to high dose. Now here's what it does. It does indeed to help with lowering your appetite, decreasing your hunger, bringing blood sugar and insulin levels down, aka resulting in weight loss. However, many folks that have come off of that in turn start to regain that weight. The studies say within 1 to 2 years, but we've seen it faster in some of our patients. So I would encourage you all to, if you're starting Wegovy, you can start it as a jump start, but have a healthy gut, healthy hormones, and a healthy lifestyle in pairing with the Wegovy, and then titrate it up, but then titrate it back down so that essentially, as you come off of it, then you're not having, a lot of the rebound weight gain that many people experience.
Great. Can you talk a little bit about how cortisol levels are related to PCOS? Is coffee a no-no for PCOS?
Yeah, I love that question. This is a question about PCOS and cortisol levels. So PCOS, polycystic ovarian syndrome, I have that. I meet patients all the time in the practice who have that as well. PCOS is very sensitive to, PCOS patients are very sensitive to high cortisol. And it's because their insulin's already wonky, their blood sugar is already a little bit all over the place, and stress throws them over, drives those androgens up. So depending on the PCOS symptom that you're suffering from, whether it is hair loss or acne or weight gain or whichever one it is, stress and cortisol can absolutely make it worse. Now, is coffee a no-no? Again, I would say the same thing. The 4 to 6 ounces is okay. More than that, probably not advised. So again, trying to stay within that amount, really, really critical.
Awesome. And then is the treadmill walk for about 30 minutes the simple solution against high blood sugar or HIIT?
Ooh, that's a loaded question. So is the treadmill walk or HIIT better? So if you're in a high cortisol state, the treadmill walk is better. The treadmill walk is lowering blood sugar slowly and gradually. if you are not in a high cortisol state, HIIT is burning a lot of energy, but it's going to be the highs and lows again, right? So overall, I would say the treadmill walk is better, and HIIT is something maybe if you're just wanting to relieve stress, or you just want to have some extra burn of energy. But HIIT in general is not something I recommend more than about twice a week.
Awesome. Can you accurately measure your hormones if you are on the pill?
The circulating levels, which are suppressed when you're on the birth control pill. So you have to have a lab order that is specific to those. We do those at Center Spring. If you want the information, you want to get those tested, you can be a patient even virtually. You just need to go to centerspringmd.com, and there are options for both in-person and virtual visits as well.
Awesome. And then how can women with PCOS get balanced hormones who have moderate BMI and low estrogen levels?
People with PCOS, moderate BMI, low estrogen. Low estrogen is usually because you are not processing hormones really well. You're spilling fat, or you don't have the raw materials in your diet to make hormones. So I would add in like a tablespoon of olive oil every day. I would add in MCT oil. I would make sure you're eating every 4 hours, and then in turn, over time, usually you're building back up your different levels of hormones.
And then our final question today, what foods are best for your hormones?
Oh, good question. I think we've done a few posts on that, right? So food's good for your hormones. A lot depends on the hormones we're talking about, but you can't go wrong with omega-3 rich foods. So it's going to be salmon, tuna, your nuts and seeds. Those are going to be really great for you. I think getting in foods that are high in vitamin D, those are going to be helpful too. So if you can eat dairy, getting in some organic dairy maybe once a day is helpful. I think that if you, we all need antioxidants and B vitamins and magnesium, so getting in a lot of your brightly colored fruits and vegetables is incredibly helpful too. And then we even talked about using things like olive oil, MCT oil, tiny bit of coconut oil, tiny bit of ghee. Those are all really helpful for keeping hormones nice and balanced. All right, I think we had one on YouTube where you guys, let's see if I can find that question. Okay, what are some of the things that can help high estrogen and low progesterone? So that is estrogen dominance, right? When you have a big gap between estrogen and progesterone. So again, metabolizing your estrogen a little bit better with more fiber is helpful for that, and then supporting progesterone with healthy fats, and then even taking something called Vitex or Chaste Tree that supports progesterone production has been super helpful. All right, lots of good questions today. What do you guys like hearing about? If you want to share with us, we'll know for following sessions when we do these Tuesday lives. And then don't forget, we're doing weight loss and hair loss in the circle tonight. You still absolutely have time to join. Just follow the links and you can join. And then check out our new boxes. We're super excited about our boxes, the energy box, the wellness box, and the hormone box. And of course, I'm super excited about this. And we are using it here at home as well. Our shampoo and conditioner, getting lots of great reviews on this. I can't wait for you guys to try this as well. All right, thank you guys. Thanks for joining today, and we'll see you next week. All right, take care. Bye.